is faced with its already overwhelmed health system. For example, Mother2Mother South Africa has taken it to task to help educate the public on healthcare related problems. The organization has created a WhatsApp platform that enables the public to ask or get assistance on health-related matters, including the latest stats on COVID-19 and the vaccine. We're now joined via Zoom by Shombi Ellis, Mother2Mother's Country Director, South Africa. Very good afternoon to you, Shombi. Thank you so very much for being with us here on SABC News.
Good afternoon, and thank you so much for having me.
I must tell you, I really love this concept of, not only empowering women that are living with HIV, but also employing them, to impart knowledge to other women. Let's talk about Mother2Mothers and how this all came about.
Thank you very much. And like you said, our model really looks at empowerment. We were started over 20 years ago here in South Africa, so we're proudly South African. And really, we were looking at the fact that, we needed to extend health services as well as education to women, their children, as well as their families through health facilities. And that's how we work. Like you said, what's unique about our model is that we actually work with women in communities that are living with HIV that we call mentor mothers. And then they become frontline health workers working within our health facilities to sort of work with the team of health facility staff that are there to be able to extend services. When Mothers2Mothers started, we were known really as an HIV and AIDS organization, but we then extended into sexual and reproductive health. We also do early childhood development. And then, of course, now we're venturing into supporting sort of South Africa in the fight against COVID-19 and extending our services that way. Our model really centered on community and using the community to solve the health needs of those community members.
I mean, who engages with this virtual platform? I mean, if I can say, it's not the correct terminology, but who's your target market here?
So it's actually for any South African. It's a virtual mentor mother platform. It's an interactive service on WhatsApp. And essentially what it is that it provides the essential healthcare that we thought was important to ensure we get out to anybody in South Africa that they may need. Health information like basic HIV and AIDS, what's happening on COVID-19, pregnancy, information on breastfeeding. The nice thing about it is that it's rolled out in each of our 8 countries, even though we operate out of 10, we're extending it to the other 2, and anybody can access it. And it's also in 10 of our different South African languages, so you can access it in a language that best suits you so that you can get the health information you need, especially during a time where sometimes it's difficult to get into the health facility and get that access to care due to COVID-19 and the restrictions that are in place.
And I mean, what is some of the assistance that is given? I mean, we here at SABC News, for example, do give out information in terms of the stats and so forth, but the problem is always in terms of the execution, in terms of step by step. All right, so from this problem, here's what you will do, here's who you will speak to, and this is the way forward. We know that there's already so many issues within our health system. There's also backlogs, there's issues in terms of getting the right health care. How do you then sort of interject or interact apart from just giving the certain knowledge? And of course that knowledge and information is important, but I wonder in terms of execution, in terms of someone wanting help further than just the information part of it.
Great. So I think that goes back to our model. So we're based out of health facilities in the breadth of South Africa. And essentially the way the mentor mother model works, as we said, we originally started as mainly focusing on HIV and AIDS, especially prevention of mother-to-child transmission. So if you can think about it simply, essentially you have a health buddy, somebody that's already walked that health journey that now is walking you through. So as a pregnant woman that's walking into a health facility, you may be scared, you've just gotten your HIV test. How do you walk that health journey so that you can ensure you have access to treatment, you stay on treatment, as well as ensuring that we don't pass along the virus to the little one and we end pediatric AIDS. So we walk the journey with those pregnant mothers, their children up to 2 years with early childhood development, and even extend it out to the families to ensure that we're really looking at the family model and the families are getting extended services through the health facilities as well as at community level. So think about a buddy in health. That's essentially what we'd be. So we walk that journey with you from the day that you step into the facility, ensuring that you're adhering to treatment. And then even after you've given birth, how do we support you to ensure that you have a healthy, thriving family?
Yeah, you speak about the fact that, when Mother2Mother sort of started, it was more focused on HIV-related issues. Let's talk about, plans going forward. I mean, you've spoken that, you've developed over the years, and certainly I'm sure you've got other plans and things you would like to implement going forward. Right now we're dealing with a pandemic, and no doubt a lot of your questions will relate to COVID-19, and I wonder, about questions in terms of dealing with one virus and another, in terms of maybe a mother who's HIV positive and then also having to deal with COVID-19. I mean, that's quite an issue to deal with. So what are the plans then going forward as you develop?
I mean, we had to pivot really quickly with COVID-19 because, first of all, we needed to ensure our staff, our frontline workers were safe. So securing PPE, making sure they can work from home. They needed to learn how to work from home and have virtual platforms so they could continue to support the clients. And extended to that is really saying that, how do we take what we call mHealth, using technology to be able to leapfrog some of these services so that services are not interrupted. So if COVID-19 or another pandemic comes through and we have a facility that's closed, or a mentor mother, or even another frontline worker that can't make it, how do we use technology to still extend those services? Essentially, our movement has also expanded, like we said, into early childhood education. We're looking at non-communicable diseases. And of course, as Mothers2Mothers, we're constantly innovating to see how we can be part of the healthcare movement and ensure that we're providing those critical services. Adolescent health is also a priority area for us. So we've done a lot of work with partners in South Africa as well as other countries on adolescent health. So those are some of the key priorities moving forward.
Yeah. When we started our conversation, I was saying to you that I really do like this concept, particularly of empowering women and not just making them, come to you with a begging bowl, in terms of giving them, empowering them with something that they know intimately, and having HIV positive local women being able to talk to other local women about something that they've actually walked through. I'm sure in that time you've had, in the 20 years that you've been around, that you've had some really amazing success stories of some of these local women who are HIV positive, who went from being just these local women and now being able to assist other women. And I'd really like to hear about some of those that sort of stand out to you.
I mean, you hit it right on the nail there. We couldn't do what we do without our mentor mothers. And these are amazing women that live in these communities, that have these networks, and really are trusted members of those communities. And just one story that comes to mind is, I recently speaking to a mentor mother, and she was saying that as a result of being a mentor mother, she's been able to sort of, exponentially change her life from having meaningful work that she's part of, from being a trusted member of a community, from being able to build a house for her family as a result of this meaningful work, from being able to provide access to healthcare. So it's just inspiring stories. And these women really are the ones that tell the story for Mothers2Mothers. So we have a group of spokeswomen that essentially are the ones that are the voices, because without them, we wouldn't be able to do the work that they do. They're the heart of the organization.
Yeah, it's such a pleasure talking to you, and really just to hear those sort of positive stories where something negative has been turned into something so positive. We certainly do appreciate the work that you're doing, and it's been a pleasure chatting to you this afternoon. Thank you.
Great, thank you so much. And for the number, in case anybody wants to access, it's 0600109000. All you need to do is send hello, and then basically you'll start the conversation and access the health information you need. That's 0600109000. Thank you so much for having me today.
You're most welcome. I hope our team will be able to put that number up quickly for us. Thanks so very much. That's Shombi Ellis, Mothers2Mothers Country Director, South Africa, talking to us about the work that they're involved in at this time. I'll certainly get the team to try and put up that number for those of you who would certainly like to get involved with Mothers2Mothers. All right.